The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. I'm Physician Assistant Frank Smith. Welcome to the Patient Talks. On today's episode, we're going to be discussing hypothyroidism. Hypothyroidism is one of the more common chronic medical conditions that we see in family practice. But because the labs are backwards from what you would usually expect, it can sometimes get confusing for patients. But we're going to break all of it down today so you have a better understanding of hypothyroidism. To start with, we're going to do some basic anatomy and physiology of what's going on. The thyroid is a gland that's located right about here on your neck. The classic description of it is a butterfly-shaped organ that sits right here. It produces a substance called thyroxine. Thyroxine is a hormone, and its job is to basically set the idle for the human body. If you remember my show on diabetes where I had talked about sugar being the fuel for the cell and for the body, well, thyroxine determines what the idle is for the engine of the human body. If you've ever been in a car that the engine was set too low on its idle, you know how the engine would sit there and chug and barely run and sound like it was going to die at any time. In a lot of ways, that's what happens with hypothyroidism. A patient will present being just exhausted. They're sleeping all the time. They may have put on some weight. Skin will be dry. They may be constipated. Nails will be brittle, and their hair starts to thin out. All of that is due to a lack of sufficient thyroxine to keep the idle of the engine up to where it's supposed to be. As far as what causes hypothyroidism, in modern society, far and away the most common cause is an autoimmune disorder, and that's where our own immune cells start to not recognize the thyroid as part of self, and they attack it and ultimately kill it. This is also sometimes known as Hashimoto's thyroiditis. So if you've seen that in your chart, that's the underlying problem, where your own immune cells have killed off the thyroid, so it no longer produces the thyroxine that the body needs in order to function properly. The typical patient is a middle-aged female, but it can happen at any age. There is another type of hypothyroidism we don't see nearly as often. We call it secondary hypothyroidism. In this, the thyroid itself is fine, but it's not receiving a signal to make thyroxine. At the base of your brain, there's another gland, an organ known as the pituitary gland. It's a multi-purpose gland, but one of the things that it does is it produces a substance called thyroid-stimulating hormone, or TSH for short. And that does exactly what it sounds like. It tells the thyroid to produce thyroxine. The pituitary has, for lack of a better word, a sensor that measures the idle of the human body and how much thyroxine is flowing through the body. When it detects that the idle is set too low and there's not enough thyroxine, it produces more TSH to tell the thyroid, hey, you need to produce more thyroxine. And that's why you will hear when you get a phone call in the labs of your labs were high, but your thyroid is low. When thyroxine levels are low, pituitary produces more and more TSH, so the levels of it will be high in the bloodstream. TSH is a common lab that we do as part of just our normal routine labs for an annual wellness examination. Sometimes the pituitary itself can fail, and so what you end up with is while your thyroxine levels are low, it's due to the fact that the pituitary is not producing any TSH. However, there tends to be several other symptoms that go along with that because the pituitary is a multi-purpose organ. As far as treatment for hypothyroidism, to be honest, this one's pretty straightforward. We have a medication, a synthetic thyroxine that you will take every day to replace what your body no longer makes. It's important to take this one at the same time every day, and because it needs to be taken on an empty stomach and at least 30 minutes to an hour before you eat, I usually tell patients to take it first thing in the morning when they get up. The dosing on this can also confuse patients a little bit as well. We need very, very little thyroxine for our bodies to do its job. Most medications that you see are measured in milligrams. Thyroxine is measured in micrograms, a far smaller amount. So you may see on the bottle 100 mcg, but occasionally on a bottle they will still put it in in milligrams, so it will say 0.1 mg. So if you and a friend are comparing notes on your Synthroid dosage, be sure to keep in mind one bottle may be in micrograms and another one may be in milligrams. And it comes in multiple strengths. At our clinic alone, I counted, and we have 13 different doses available, and that doesn't count the ability for me to take one pill of one strength and a strength of another to produce a third strength. And it's because it's such a minute amount that we need, but it's a very, very specific amount that the human body does need. As part of the workup for your hypothyroidism, your clinician may have ordered some additional studies. For example, they may have ordered an ultrasound of your thyroid. The reason for that is there are some other things that can cause hypothyroidism. One, for example, is you can develop nodules within your thyroid, and we'll call them cold nodules, meaning they don't do a whole lot and they take up space, and so the overall effect on the thyroid is that it's producing less thyroxine. There are some other things that can cause it as well, to be honest, like thyroid cancer. So if your clinician has ordered additional studies, please go and get those done just to make sure that it is simply Hashimoto's thyroiditis. And that's going to do it for this week's show. I hope I've passed on some information that you needed, and I hope it's been entertaining. If either one of those is true, please click the like and subscribe button down below. I'll be back next week. Until then, get better, make me look good. See you soon.